So today we're going to be performing a complete bed bath for our patient. The instructions will be illustrated, performed in this video. So before any supplies are obtained, the first thing we would need to do is confirm the order is correct, and we need to introduce ourselves to the patient and confirm their identity by 2 forms. So good afternoon, my name is Jenny. I am a student nurse, and if I can just confirm your date of birth and your name, and usually that can be found on the wristband. Okay. Then once we confirm the patient's identity, we'll go and collect the supplies and return to the room to begin the bed bath. Okay, so here we have, so to begin, we remove the patient's pillow, making sure that we are careful with their position. So we'll place a dry, clean towel under their head, and then we'll ask the patient if they have any contacts to avoid any injury in their eyes. We will then have the towel, I guess, that's rinsed in water, warm water, and we'll go ahead and fold it over in the way that it shows us. And then we will tuck it in as such. So starting from the inner canthus of the patient's eye, making sure their eyes are closed, we go from in to outwards. And then once we go to the other side, we flip it over, making sure that it's a new clean area of the cloth from in to out. We're gonna dispose of this towel, and we're gonna use a brand new one, okay? So once we are done with the eyes, we're going to use a dry towel to pat gently the eyes, okay. And that's that. Then the next part that we're gonna do is we're gonna ask the patient if they prefer to use soap when washing their face. Then from there, we'll grab a new washcloth and fold it in the same manner that we did first. And then we'll tuck it in here, okay? And then what we'll do is, starting at the forehead, we'll come around to the patient's face, their cheeks, part of their neck, and up to their ear. Then with the other side, we're gonna do the same. Starting at their forehead, around their face, towards their cheek, towards their neck, and around their ears. And then we'll clean their nose, okay? Then once we're done, we're gonna rinse that. If we did use soap, we would rinse the towel, and then after rinsing it, we go back and wipe to remove the soap. Then once we do that, we would grab the dry towel, and we would dry gently the face, the neck, and the ears. Same thing for the other side. Okay. So once we're done with the face, then we remove the blanket behind their head, and we would now move on to the arm. So with the arm, we put the dry towel underneath, and then when we are doing the arm, we would start at the fingers and move our way up to the axilla. So again, getting a brand new towel, folding it in the same manner, tucking it in. So here. Okay. So again, starting at the fingers, making sure to get in between the fingers. And for the arm, we want to use firm strokes to clean well. Okay. Then we would rinse that, and again, if the patient has soap, we would rinse it to wipe it over again with a clean towel. Okay, once we do that, we get the dry towel and we dry the patient's arm. This is the time where we would add any deodorant if necessary. And also to mention, before having gone to the arm, once we were done cleaning the face, it would be the moment to shave the patient if they're male, making sure that the skin is soft. So once we're done with the arm, we're gonna remove this towel and we're gonna move to the other side. So the same thing. So grabbing a brand new towel each time, again, wrapping it in the same format, making sure that it is tucked in, okay? Again, starting from the fingers and working our way up to the axilla. Okay. Rinsing it, getting a new one, taking off the soap from the fingers up to the axilla, okay? Then the next step would be making sure that the bath blanket is in position. We're gonna move the bath blanket down, and we're gonna place this same dry towel over the abdomen and chest so we can then clean the patient's chest area. So again, brand new towel, wrapping it, tucking it in, and we're gonna clean the chest in a downward position. If it is a female, it is important to clean under the folds of the breast and around the area. Okay, rinse, get a new one. Then once we're done with that, we're gonna get the dry towel and we're gonna dry the patient in that area. Okay. Now at this point, once we're done with the chest, we're gonna move that same dry towel, we're gonna place it over their chest area. We're gonna bring up the bath blanket and we're gonna expose their legs. So at that point, we would get, again, a new towel, wrapping it, tucking it in. Oops. And this way we're going to start from the toes and working our way up to the knee. And then we will rinse, new towel, rinse and wipe long strokes up to the knees. And then we'll dry that area. Then we'll work our way from our knee up to the thigh with a new towel. Okay. And the same thing goes for the other side. Okay. So after that, and then we dry. Making sure that we're drying in between the patient's toes to make sure that it doesn't stay moist. Always making sure that the bath blanket is covering the patient to maintain their privacy. And then once we are done, we would be, that's it.